The Robin Hood Virus. Chapter 4, Hospital Foundation Startup. One of the struggling new nonprofit startup companies is World Rural Hospital Corporation, which is a non-HMO/PPO healthcare system that is instrumental in providing adequate primary medical care to people of any race, creed, color, and walks of life in emerging nations around the globe. WRHC has undertaken the goal of providing those same people with both the basic directional assistance and the tools, in the form of jobs and education, to better themselves, their families, their communities, and their countries. The ideals of WRHC: 1. The needs of the patient come first. 2. Medicine, which is focused on the needs of patients in communities, regions, nations, and the world. 3. Provide emerging nations with physicians, scientists, and other health professionals who are a dependable source of services and information. 4. Conduct basic and clinical research programs to improve patient care and to benefit our global society. 5. Treat everyone we encounter with respect and dignity. 6. Continuously improve all patient care, education, and research. 7. Provide for and empower our employees to perform superior teamwork, take personal responsibility, and to seek the highest levels of integrity, innovation, trust, and communication. What we do: WRHC builds and operates hospitals around the world as a humanitarian, non-political, entity for the betterment of mankind. Current operating plan. The WRHC district hospital system is a collaborative design between WRHC and the local, regional, and/or the national government to make health care a solution for the whole community. By providing affordable, and in some cases no-cost health care, the district hospital system supports the city as well as the outlying rural areas, which make up a single hospital district. Not only does a district hospital system provide a wide range of technical and administrative support for the community, but it also provides the training necessary for primary health care and community hygiene as well. Each WRHC hospital has the capacity for complete diagnostic care, with various clinics and departments, institutional/outpatient treatment, and rehabilitation, in order to ensure that patients are guaranteed to receive the highest level of competence when dealing with their individual needs. In order for the district health system to recognize itself as an integral part of a district health system and of the larger health system beyond, it will share in district-wide information gathering, planning, implementation, and evaluation of health services programs, which will include budget reviews and the monitoring of programs through management and technological information systems. WRHC is currently designing an information and technology system in conjunction with several large and well-known international companies which, when completed, will link every hospital and administrative facility to one another, around the planet. Our goal is to bring each hospital into the digital age by providing the latest in digital technology to the administrative offices, the operations areas, and right to the patient bedside. We can accomplish this by using slates, convertibles, and personal digital assistants in conjunction with standard desktop technology. The system will move calls around the country or around the world at the touch of a button. Doctors will be able to exchange patient data, body imaging, and do so while seeing each other face-to-face via video conferencing. Surgeons will be able to utilize the latest in robotics and computer technology in surgical operations and surgical procedures to be carried out from a distance, telesurgery. We are fortunate to have some of the best technological minds available to accomplish this task. WRHC's projected localized economic impact. Several factors in our methods of carrying out our goals for each country can have a significant impact on the economy of most emerging nations, a moderately favorable impact on the economy of many countries who are not considered as emerging, but are still in their middle developmental stages. In many emerging nations, three factors, among several, contribute significantly to a poor general economy: 1. Unemployment due to lack of marketable skills. 2. A poor, inadequate, healthcare system. 3. A circumstance known as the brain drain. In many emerging nations, the majority of employable workers are generally from an agrarian background. To work in the industrial sector, they require training and education, which most countries cannot afford. International companies are not willing to spend the money required to bring the available workforce up to standard when trained workers may be more readily available elsewhere. Healthcare in emerging nations is generally provided, sparingly, by the government and/or by relief organizations and religious organizations on a limited basis. While the quality of the physicians and nurses may be excellent, the hospital buildings and equipment are far below what might be considered second-rate even by standards which are lower than those enjoyed in the United States and other developed nations. All access to treatment is really controlled by the financial ability of the patient to pay. Uganda, as an example, is a very poor country, where the annual income per capita is around